Rubin, welcome to Startup Grind. Thank you for being here.
Thanks for the invitation.
Of course.
I feel honored.
I'm happy we were able to do it. I know we were supposed to get together in April, but we stayed committed. I'm really glad that finally we were able to come here together.
Yeah, I think I had something. I think probably had a vacation or something came up that I couldn't make it. But I appreciate you,
of course,
for the re-invite.
Yes, anytime. I mean, So I'm not sure how many people know you, but I know if they don't, they ought to, and if they don't yet, I'm sure they will soon. But for those that don't, can you mind sharing a little background on you and your journey up to starting Patient Plus?
Yeah, I think we overuse the term local boy, but I'm truly am a local boy for Baton Rouge. I grew up here, went to Episcopal High School, graduated in 1990. Unlike many others that are local, I did get away. I ventured away, went to University of North Carolina, graduated from there, came back for med school, and graduated from med school in 2000. And then from there, I went to Earl K. Long residency. Okay. And from there, worked for a pretty large group as an internist. Yep. And several years into that practice of mine, I decided to help them out with their after-hours program. I actually took it over. Yeah. And from there, we kind of went into an
Earl K. Long. And where are we at here? In Louisiana?
Worked for a major healthcare provider in this town.
Okay.
Blue and yellow.
Gotcha.
Are their colors. So, and I was their internal medicine guy for a couple of years, and then they had an after-hours program that nobody really wanted to do, and I basically took it over, took ownership. And then from there, we grew it into an urgent care program from half a day, Monday through Thursday, and then finally had a very smart, a middle management individual named Navu, and she was she agreed with me that we needed to kind of take this further, and we made it 8 to 8 every day. Okay, and even opened it up on weekends. And just like everybody else, not everybody else, some people stick around and want to be part of an organization all their lives. I just wanted to do something on my own. Yeah. And there were some decisions that were made at that healthcare organization. I finally decided to say, okay, if I'm going to make that move, let me do it. And so what I finally did is I founded Patient Plus Urgent Care. And we founded Patient Plus in end of 2015. And we started our first clinic in January of 2016, Patient Plus Mid-City.
Nice.
And then from there, as you know, Castro, we're now up to 7 clinics. We just opened up Patient Plus St. George this past May. Yep. Memorial Day kind of area. And we're actually building number 8. We're happy to open Patient Plus Brewley, October 2021. So coming up in the next 2 months. So, and so that's my story.
So the one in St. George, is that the one off of Seguin?
That is.
Okay. I've lived in Seguin, somewhere on Seguin in that area for a few years, and then when it got changed, people were like, "Oh, you live in St. George?" I'm like, "I'm not sure." Yeah. I guess now I do.
That's to show you how much of a local boy I am. I still recall when I was growing up, going over that bridge and being like, what part, are we still in Baton Rouge? Where are we, right? It was still 1 lane or 2 lanes going back and forth. This is when Seguin was 2 lanes, guys. So, and now obviously it's 6 lanes. When you get to St. George side of Seguin, it's 4 lanes. But I still recall going over that bridge and going to neighborhoods and like, where are we? And now I actually live on that side of town. I live at Highland and PQ. And now to even have a clinic on that side of town it's just very nostalgic. And I feel rewarded that I'm actually bringing stuff to that area as well now.
Yeah, especially in the area you grew up in and you came back to. And well, I'll say, my first experience with Patient Plus was during the pandemic. I started getting, I took over my family's restaurant during that time, and as part of in Denham Springs, yep. Right. And one of the first things there was definitely a scare of as soon as you get it, we had that labor shortage was no joke, so I was getting tested every 2 weeks, 3 weeks, and for 3 of those, I went to Patient Plus. It was kind of the latter as things started slowing down. And I remember one of the first things I noticed when I walked in, I was like, this space is very open. Like I was like, everything's white. There's glass. This is not the urgent care that I'm used to. I'm curious. Was that intentional? Because I definitely felt like it was one room, like one big room versus, all right, I'm in this cubicle in this quadrant, and once I have been released by the head of this urgent care, I may enter the next quadrant. And like this weird, game that I'm in or maze.
And you bring up an excellent point. The medical experience that we all know is you walk into the office, someone slides a window open, or someone's sitting down looking up at you, and then you go sit in this up box, right?
Yeah.
And then from there, you wait for them to call your name. And then after that you go sit in this other box that's probably cold and dark and barely any light and dim. So the vision for Patient Plus was I'm coming from the entrepreneurial business myself, just like you, Kasra. Our families are entrepreneurs. We come from the hotel business, right? So hospitality, treating patients the way they want to be treated. First things we wanted to do is make it more open in the front. We also wanted to make it to where you feel you're part of the process, right? So you see what's going on at all times. You talk about that glass.
Yeah.
We put that glass there so you could see behind. We're not trying to hide anything. We want you to see the whole experience. So after your name is called, you go into a room, and we have a window in that room, a high window where sunlight's coming in. So you have some natural light coming in. You have a TV, so you can watch TV if you want, if you're not busy on your phone. And we have a glass on the door. And the glass on the door also represents transparency. You literally can see what's going on in the nurse's station. You can see if they're goofing off. You can see if they're eating, which they're not supposed to be doing, or they're playing on their phone, or they're actually working. So you can see all that, and it puts them in their light, like, hey, I better be doing what I need to be doing. Now, if you don't want to be part of the experience, you just close the curtain.
Yep, seen that.
And so again, this was all thought of, and the thought about the door, the window on the door for the examination room is, at my previous place, I can't tell you how many times people would open the door and say, "Did you forget about me?" Now, of course, we're like,
no, we're
no,
working.
we didn't.
Yeah.
But then some of the things I used to do is, as I was going down the hall at my previous place, I would open every door and say, "Hey, you're number 3, you're number 2, you're number 1. Now we don't have to do that because now they can see what's going on.
Yeah.
And they feel like they're part of the process.
Yeah. No, I love that. And that experience resonated with me. And then from there, I met you here. I was actually, visiting with Patrick Rubin, who runs the Patty G show.
Right.
And I remember seeing you here. And I think that's where we actually first connected. So now, that was sometime last year or early this year. I'm not
I think it was pre-COVID.
Maybe.
I believe it was pre-COVID.
Wow, it was that long ago. Okay.
Yeah. So it may have been, it's definitely more than 18 months ago.
Gotcha. Okay.
It may have been 2 years ago, but it was, I think, pre-COVID.
Okay. So getting together, I'm glad we did then. It's been a minute then.
So I guess, are we going to be saying like BC and AD? We're going to say pre-COVID, post-COVID one day? Like
Maybe.
That'll be the terms that we use to reference our lives?
I'm sure. Well, man, we were talking on the phone the other day, and there's a lot I want to get into today, and let me, just to kind of break down it, and for anyone listening or watching, that we want to really talk today about decision making. We're going to talk about the effects of COVID, but one of the things, and in the 3 parts I want to talk about it, is really the situations that require decisiveness, which clearly, COVID things that are crucial that you make a decision, but also have big impacts, how you go about the decisions, and how you actually measure the long-term impact of the decision itself. Now, pre-COVID, what was one of the toughest decisions you've made, you think, in the business?
I would say one of the toughest decisions I had to make was, we were probably, I can't remember if it was South Downs and going to Delmont, or Delmont and then going to Prairieville and Broadmoor. We were at that point where we wanted to expand more, but the revenue stream may have not been there where we wanted it. And it was one of those decisions, okay, do we keep pushing forward with our growth plan that we want to achieve, even though we're not seeing the revenues we're seeing or we want, or do we hold back? And that was probably one of the toughest decisions. Okay, we're going to go forward. We know we see the vision, we see the plan.
Yep.
We know if we hit these kind of numbers that we're going to be there, but we can't hit those kind of numbers unless we get to the next 2 or 3 clinics. So that's the toughest decision, besides many other decisions before that.
Of course.
That was probably one of the toughest ones I had to make.
Yeah. And especially considering, I mean, you're really reshaping what the goal is, what the milestones that you have to, as far as revenue. But yeah, I mean, it sounds, and I think that's something a lot of entrepreneurs have to do, is that they look, we're not hitting every single milestone. Otherwise everyone would do this, right? That you're not, but you have to make a tough decision and say, okay, we're going to add in some different rules. We're adding multiple locations. And in order to get to where we want, no, we haven't hit it with one location, but let's go for 2 and 3. And I think we'll still get there. Was there any moments in there where, from the time that you made a decision to actually getting the 2nd and 3rd location, that, some serious doubt started coming in?
Oh, the doubt started day one when we opened the first clinic, Patient Plus Mid-City.
Yeah.
We were only seeing 3, 4, 5 a day.
Yeah.
And you're just sitting there going, wow, I don't know if this was the right decision.
Yeah. Because there's sick people out there.
Huh?
Because there's sick people out there.
Well, there's sick people out there, but, we were in the Mid-City market. That's a hard market, because they don't, first of all, urgent care probably wasn't known to them at that time. Plus, you're in a market where you're seen as an outsider versus St. George, or South Downs. You just can open a business, and, there's certain parts of our communities, whether you're in Baton Rouge, New Orleans, New York City, there's certain parts of the community that if you're not in that network, in that community, they're not going to consider you for a business. So there was a lot of, I really think I learned a lot about marketing that day, from that clinic. And what I mean by that is, when I would see patients, I would talk to them and make them, feel good and tell them what was going on. And at the end of that conversation, I was like, so, I would just talk to them about Patient Plus. I said, how do you like the clinic? Do you like how we were doing things here? They would tell us, yes, we loved how they, thank you for being here. I was saying, and I would tell them, look, if you really, could you do us, please give us a good review. No, I would tell them, please review us on Google.
Yeah.
And I would seriously tell them this. I said, whether it's good or bad, I want you to tell us what's going on, because we cannot improve unless you tell us what's wrong.
Absolutely.
Right? So that's how we grew that. And we grew that because in that community, it's word of mouth. They're not necessarily going to look at Google. Okay?
Yeah.
They're going to hear it from their friends and families and say, hey, we went to Patient Plus. It was a good experience. That they've done something there for our community that no one else is doing.
Yeah.
So they are taking a chance, and they built something that's very nice. And those were the kind of comments we were getting all the time.
Yeah.
So within 6 months is when I was like, okay, we did the right thing here. We're helping people. And the numbers really started picking up, around September or so.
Yeah. And so, well, on the note of Google, look, I recently moved to New Orleans, and I can look on my phone and look at good restaurants nearby, and every single one has over 4 stars. And I'm thinking, how do I know? Where do I go? I go to the places that I'm recommended. Me and you talked before the show started. You gave me a recommendation. I went to Google, I added it to my saved list of restaurants to go to. That's how I'm going to be passing out my business,
Right.
you know? But it's, yeah, I mean, it really is how we all do things. Now, let's get into the pandemic hits. Since that moment, what's been one of the toughest decisions that you've made in this era?
Well, we can go back to March of 2020. And before the pandemic actually hit here, we always have our admin meetings on Tuesdays. I remember, that meeting, one of the first meetings I said, hey guys, I think everyone's underestimating what this is going to be.
Yeah. I
think we need to prepare for what this could be. And some of the toughest decisions were made in those first couple weeks. The decisions were which clinic to close, what do we do with all those individuals that are maybe full-time versus part-time, supplies, do we have enough supplies? What if we don't have enough supplies? What are we going to do? So those were the biggest decisions we made. And in those meetings, we decided we're going to shut this clinic down.
Yep.
And we're going to shut this clinic down because then we can conserve those supplies, spread that out to everybody. And we're talking about PPE. And we can also use those those team members. We don't say employees, we say team members, and use that at our other clinics.
And this is before things started shutting down or right before?
This is this is probably 2 to 3 weeks before we started having usually admin meetings, but I started saying with my team, I said, look, these are the things we got to start thinking about. And I hate that I was right.
Yeah.
But we were prepared to know which clinic to shut down and what we were going to do with those people, those team members.
What was your insight there? I'm curious, because looking back, we're, a year and a half almost right in, and there, if you looking back, you look at those that acted really quickly. Either they just didn't want to take a chance, or they, had either they knew people, they've had guidance. I'm curious what led you to tell your team, hey, this is bigger than what we think it is, because I would say it's that urgency. It's that, hey, there's a fire, even when there's not a fire. It's that moment. It's getting people ready to put out a fire before it's there.
Castor, I think I'd be lying to tell you what that exact point was or that logic was, but I think it was several items. First of all, I saw what China did. Yeah. When China shut down Wuhan, when they shut it down, they blocked the roads, couldn't get out. They already had shut down the flights. And then when you saw them barricading buildings, like wouldn't let people out of buildings.
Yeah.
That hits home, right?
Right.
We're such an open society. You're going to be called cruel if you do that.
Yeah, we couldn't comprehend that.
Yeah. You get thrown in prison for stuff. But they shut things down, control their virus versus us being open and nobody wants to tell us what to do. And so I was like, eventually, and then I also saw what was going on in Washington. Yeah. State of Washington. And you could see how it was spreading very quickly, especially to individuals that were older and immunocompromised. So I think it was several factors like that that I saw. I think it was more an apprehension on my part.
Yeah. Yeah. I'll say, for me, so the experience I had was definitely one of not, I was like, hey, I'm not sure that what this is, not that worried about it. My mom was actually in Iran. She went to Iran in late January, goes out there. 2020. Of 2020.
Okay, good.
She's on her way back in March, and her flights start getting canceled.
Yeah.
Week after week after week. So I actually went the week that everything closed down. We were in Chicago for my friend's bachelor party. So we're at the bar and we're all sitting there. We're having a good time. Again, we'd hear rumblings, but maybe we're just too in the, zone having fun. And we're at the bar and we look up and I go, hey guys, I think they shut the NBA down, and then the next day, the St. Patty's Day parade gets shut down. The next day, our tour of Wrigley Stadium, Wrigley Field gets shut down. And there was this like slow, and in this whole time I had this voice, which was my mom calling me and telling me, they're not showing what's really happening. Mm-hmm. People are dying here. Cancel your flight, drive home. Now, against my better judgment, I said no. I said I'm flying home. I moved my flight up. I flew home, and boy, did it really start then. Now, and I'll say it's like this feels, and when we talk about decisions, like the decisions you have to make feel, the reference point of this pandemic is, it's just clear. This is a crisis. You have to make tough decisions. Is there something about these situations, or is there characteristics about things that happen that all of a sudden there has to be urgency about, because I think it's easy to point to a pandemic and say, it's a pandemic. We should all be urgent. We should all make decisions, right? But as it starts fading in whatever form that is, and I know it's maybe not timely to say it's fading right now, but in whatever form that is, there's hundreds of other moments for us as businesses and as entrepreneurs where there's those crucial moments they have to make decisions, and either they do or they don't and make the right or wrong one. What do you think are the characteristics of situations that require decisiveness?
I think you said a couple words: decisiveness, leadership. But the other word that you have to think about is teamwork. Trust your team, right?
Yeah.
My admin team, I trust my team. I ask their opinions, ask their advice, and then we make a decision as a team. Now, if I need to make that unilaterally, I'll make that decision.
Yeah.
But it's trusting your team, and that comes back to making sure you've got the right people on your team.
Yeah.
But decisiveness, and when you make that decision, be confident with that decision. Now, be willing to change, because sometimes you might make the wrong decision and you got to change that decision. So I think those three things: decisiveness, teamwork, and the ability to change.
Yeah. Now, you said pulling in your team, getting their feedback. And you gave a little example when the pandemic hit on how you made that decision, or how you started, the getting things going to get you all prepared. What framework or process do you follow in these kind of moments to make these kind of decisions?
There's intuition.
Yeah.
There's also history.
Yeah.
I look back on our historical processes that we do, but also decisions we've made. I look back at that decision in March of 2020 of which clinic to close, and then when we had to close a clinic recently, we didn't close the same clinic. We closed a different clinic. And I'll tell you what happened the first time. I think you were asking this question and I didn't get a chance to probably follow up with it. We closed our Prairieville clinic the first time because we had just opened it in November.
Of 19?
Yeah.
Okay.
So we were only 4 months in. We hadn't seen the great numbers that we thought we'd see there. So it's kind of an easier decision.
Yeah.
To close that one versus Broadmoor, which we had just opened, because we'd already seen great numbers at Broadmoor. So that was a fairly easy decision of if we had to close, which one. This time around, just several weeks ago, we had to decide, okay, we don't have enough staff. COVID is rampaging our staff. Which clinics do we have to close? Before it was a closure of there wasn't enough patients.
Right.
We didn't have enough PPE. This time it was plenty of patients to go. We have our PPE. We have plenty of tests. We're just getting ravaged with COVID. That decision this time we decided to close Bocash because we felt like we had enough ancillary clinics around to cover the Bocash area, meaning they could go to South Downs, they could go to Broadmoor, they could go to Mid-City. And we didn't want to close Prairieville this time because Prairieville was doing well.
Right.
And we didn't want to sacrifice Ascension Parish from Patient Plus because they already knew us.
And this is from just not having enough team members.
Correct. We were just, at one point, we were down 7 team members, which is basically a clinic.
Yeah.
And so we were down probably a week. We shut down that clinic for a week, but then we made it into a drive-through testing facility. So we could do half the staff.
Yep.
And then this week we started it back up again, full staff. We feel like, knock on wood, hopefully we've kind of survived this COVID surge of illnesses.
Right.
And we've been hiring nonstop, if we can get them in.
Right. Yeah. Which is,
well, I mean,
tough.
it's funny. We hired several people, and then sure enough, a hospital came in and goes, "Oh, we'll hire you. Not only will hire you, we'll pay you $2 more than what they're paying you, and we'll give you a COVID bonus." And you're just like,
wow.
man,
Yeah.
you can't. How do you compete with that? I'm not a hospital, right?
Right.
I'm not one of
right.
these three big giants in this town.
Yeah.
So, but I think it went off tangent. But I wanted to make sure that those decisions, they come fast and furious. But again, decisiveness. I talked about teamwork, ability to change, but also I think this is what we were talking about, looking back at your historical decisions and changing based on that. So that's
let's I'm interested in I think the labor issue of hiring and is something that everyone feels. Mm-hmm. And you made an interesting point that you're not a hospital. You can't offer some of the things they offer. And I'll say, from our perspective, a one location restaurant, what we rely on is referrals. So we do a referral bonus. You get $100 if that person gets hired. You get $250 if they stay 6 months.
6 months, right?
You get immediately you walk in, you get all the clothes. We try to add. We give. In a small one shop, we do 3 weeks of PTO a year, right?
Wow.
We give a lot, but that's helped us retain the whole team during this entire period. But there are moments where and I'll be honest, there are moments where we don't feel our hiring is even doing anything. It's just the referrals, right? We call. This week, we had my sister is also over, HR and manages hiring. 4 people are supposed to be coming in. We're already 0 for 2.
Right.
But so when you're in that moment and you have this the hospitals that are, picking off potential candidates, what have you guys done in this time or what have you been thinking about the situation?
So, I go back to historical perspective and looking back when the first couple of surges, what should I have done to help our team? This time around, we bought lunches every day from Monday through Friday for all the clinics, the entire team. And we've done that for the last 4 weeks until this week. We also cut down on our hours on the weekends. Instead of 9 to 9, which were every single day, we went to 9 to 5.
Nice.
Just to give them a break and make sure they can build up their immune system again.
Sure.
But we still paid them for 12 hours. For 12 hours.
Nice.
$50 gift cards here and there.
You're saying thank you for being here.
Yes.
You're not letting them. You're not saying that, hey, you may not see me. You may not even see, it's in, it's out, it's in, it's out. But like, we notice, and I see you. I see you for the work you're doing. No, I hear that. I like that. I like that a lot.
And listen, the whether they felt that appreciation, our marketing individual, marketing liaison or director, I love to say liaison, but Morgan Moon was the one that bought those lunches every day. She had to deal with that stress, with them going, oh, I don't want this one today. I don't want this today. We had a lot of that. We were like, hey man, you got lunch. So we still hear that feedback, but these were the things we were doing. We bought lunch every day, cut down their hours on the weekends, but still paid them for 12 hours. Just little nicks and knacks just to make them feel like they're appreciated and that they're doing a great job.
Yeah. I love that. we don't always need, you don't need the the heartwarming thank you. It's like, hey, I know you got lunch. We do it with smoothies because it's been hot, and it's been hot. And sometimes it doesn't matter how much the AC's on. It's that temperature's still kicking up inside. Yeah. Right. So you just give them, but you do what you can. And so as we kind of, as the hiring, I think is coming back, and I think slowly, or at least, it's seemed like, restaurants and, well, let me ask you on the side of urgent cares, hospitals, nurses, what you may have more of a sense of the pulse of what's going on. How is that side doing? Have you seen, like, I know there's a shortage still.
Burnout, stress.
Yeah.
If you're working in the hospitals at this time, and you are working in 2020 and in December and January of this year, and you're still working in the hospitals, I applaud you.
Yeah.
That is a high anxiety, high stress environment where people are dying every day. People are suffering every day. And, I would say in our clinics, we have it easy compared to the hospitals. We're just, you have COVID. No, you don't have COVID.
Yeah.
Here's what you should do, But they're the ones that are burning out and leaving in droves. And so, we're just kind of down the radar here, but we're struggling. I can imagine how much, and I've seen it because before this latest rush, I went to go visit a friend of mine in the hospital, and I'd walk down and I was just like, man, these hallways are empty. This wing doesn't even look open.
Yeah.
And it was funny that the patient that I went to go see, I asked, somehow I mentioned it, and they're like, Rubin, they don't have enough workers. That's why they're empty. Otherwise, they probably might be fuller. They just don't have anybody left to work.
Yeah.
So that, wow. I mean, that hit home.
Yeah.
That really hit home. And then this week, in fact, it was today, I was talking to someone by text, and this nurse was saying that, I visited the ICU or I had to work in the ICU, and it was, let me tell you something. It was an eye opener. I cannot imagine how these individuals have to, whether family members or people working in these ICUs are managing every day. So, the shortage is there, and it's because people are burnt out, and they'd rather not work in that environment anymore. And
from the people you talk to, where are they going?
I think some are finding clinics.
Yeah.
Some are just not getting out of healthcare.
Wow.
Or, taking a sabbatical. If they can.
Right.
If they have the funds or resources, or their spouses are working, they're able to take that sabbatical. But if they're not, they're just pushing through.
Yeah.
Or they're finding something maybe less paying, less demanding.
What do you think some of these long-term impacts are going to be? Because I take a look and I see a lot of people that had whether it's burnt out, whether it's, realizing that they worked a job they never really liked, or not working for the sake of not working, whatever it may be. It's, what do you, because I can say that what I see, I've been very keen on the automation that's coming to, like, the restaurants, right? Because at some point it's a matter of, is this kind of labor rewarding enough? In post-COVID world, is this rewarding enough? Now, I would venture to say that being a nurse should be quite rewarding, though I have never been a nurse. What do you think that long-term impact is going to be? Because if those people don't come back, what happens to our hospitals?
Yeah, you have to ask yourself, what are the people in college right now thinking, right? The ones that were always going to be nurses, the ones that were going to be physicians, the ones that maybe wanted to be in the medical field but wouldn't be a rad tech or an MA. Are they now saying, no, I'm going to go? We don't know what that's going to be for the next two or 3 years, but in 4 or 5 years, we're going to know.
Do y'all recruit
We're going
out
to
of
know
college?
that impact.
Do y'all recruit out of college?
What's that?
Have y'all recruit out of colleges or those programs? Yeah.
We'll go to Fortis. We'll go to, the general or the Lake radiology programs.
Yeah.
Try to find rad techs there. We'll find MAs at these teaching programs. So we recruit straight out of college.
Gotcha.
So
yeah, I know that I'm, because just in general, that's something that I think about a lot is like what happens next. And from your, where you guys have been placing Patient Plus, the locations that you've gone to, do you have any fear of a downturn of sick people? Not to say that, but that is somewhat the business we're in, right? And you see a lot of growth in the healthcare space, and because of what's happening. Do you have any fears of a?
Well, I would say that we saw the downturn from December and January. I mean, we went from in January to February, and our patient volume went to half.
Yeah.
And we saw that same patient volume in February, March, and April, and I was really fearful what May and June were going to be. And we were going to be able to handle it. Okay.
Yeah.
But May started picking up a little bit, and June started picking up a little bit, and not from COVID necessarily. It was just regular medical problems.
Yeah.
Allergies, sniffles.
I was at a Patient Plus. I went after my bachelor party, and I got 2 COVID tests that week. And after they came back with negative both times, and I looked at her, I go, "So you're telling me I'm just weak, and this is me having a cold?" She's like, "You have a cold," and I go. She goes, "Have you done anything to where you would weaken your immune system?" I go, "No, not at all." No, you're right. We know that. I see that.
So May and June we started tricking up a little bit, but that's when I was like, okay, we're gonna be okay. If the COVID pandemic's over, we'll get back into cold and flu season. Our numbers will pick back up. We're gonna get back into our normal trend.
Yeah.
But early July is when we saw the uptick. I mean, it was first, second, third, even before July 4th, we saw this little uptick. And I was like, we're in our admin meeting. It was like, what's going on here? And they're like, yeah, we don't know. We think we're starting to see an uptick in patients and in COVID results and numbers. And we're like, interesting. And July 4th hadn't really hit yet. Yeah. And then July 4th hit.
Well, so this is actually interesting because we have the first part of the pandemic that happens. There's a lot of things that you have to decide on, a lot of things that have to change immediately for you to be prepared. Now here comes, you're in these meetings and you can see it coming. Is there any learnings from the first wave? I don't know how many waves there have been, but let's just say when it all first started to July. I see you're nodding your head. That you were able to apply.
Some of the things we've already done. We have 3 months of PPE stored away in the warehouse.
Yes.
One of the first comments was, "What's the expiration dates on those?" So of course we went to go see what the expiration dates are still a year away, so we're good there.
Perfect.
The next question I had for him was, "Hey, how many tests do we have, and are we going to run out?" And literally was, "We have plenty of tests. We have plenty on order." And not a week later it goes by and we heard something, tests were running out. And I literally was like, I didn't lose it, but I definitely got on a call. And I remember I was driving back from Hammond that day and I got on the phone call and I started making lots of calls. But so the first things we talked about were, do we have enough PPE? Yes. Yeah. Do we have enough tests? Yes. If we don't have enough tests, do we know where to get them? Yes. The next part was, do we have enough people staffed? Yes. But you never know how many people are going to go out in a week. And sure enough. So, but then during that week and the next week, we also discussed, okay, if we have to shut down again, which clinics should we shut down first? So those were the first couple of weeks where we started making those kind of decisions as well. So
I love that.
Those were the decisions that we were making.
And I think so for entrepreneurs, I think this is such an important note to take away is that the first go around, it's, hey, what do we do? And it's almost as if here now there's a process and you've picked it up and immediately you already, we're just going through the motions. So now for everything that happens in the future, in the future, there's gonna be different situations, but you now have this framework that you didn't have before that when there's rising cases, when there's a epidemic, pandemic, here are some basics that we have to go and ask, and I have to ask my team. And even if I ask my team, sometimes the answer isn't what, actually is in reality, what reality is there or not. But I just think that's really valuable. I wonder if there's other parts of your business that this is being applied to almost unconsciously, whether it's like you said, decision making of closing of a facility based on numbers, based on staff. But, if I could turn it a little bit from COVID just to general business decisions, are there other parts of the business that you're approaching differently based on some of these experiences?
When we started the conversation, one of the things when we talk about the ability to change, right? Kasha, you probably, being Asian yourself, Asians, we tend to, when we own a business, we want to control everything. We don't want to let this go or let this person handle it. So one of the hardest, another one of my hardest decisions I had was my billing team. Our billing team initially was outsourced to the EMR company we were with. We brought it in-house because I wasn't very happy with it. I didn't think they were doing a good job. We kept it in-house all the way through the middle of the first part of the pandemic. So it was November of 2020 when I finally decided enough. This is too much for us to handle. We're not doing a good job with it. I'm going to raise my hand and say, I'm not good enough for this. I failed. I'm not the person that can handle this.
Yeah.
And we outsourced it. It was a huge decision on my part because it was literally saying, letting something go, right?
Yeah.
Felt like a little part of me was going away because I know billing. I can do billing.
Yeah.
I was staying up till 10, 11 o'clock at night after I'd come home from work, after the kids were put to bed, and I was doing, whether it was putting in the ERAs, where electronic remittance advices.
And you're the one that pulled it back in. So this almost hurt a little bit because you took ownership of it.
Well, I knew that our billing team was struggling.
Yes.
And I was helping them by, okay, let me see what's going on. Let me see and I was very happy. I liked doing it. I could see the numbers. I could see, okay, we need to call this person. We need to go. And eventually it just got too overwhelming, trying to control. And really, in reality, what happened is COVID hit. We let them work from home, and it was a disaster. They weren't getting the job done. Even though we set them up with computers and dual screens, and they just weren't getting the job done. And then when we brought them back in, they still weren't getting it done. And finally, I made a decision. I have to credit Dr. Christian Hall. He's a ear, nose, and throat sinus surgeon in town, specialist, and he used a company called MRG out of Birmingham. And we interviewed them, but we interviewed a couple other companies, and we decided to go with MRG. And let me tell you, the amount of stress that was lifted off my shoulders in just a matter of a month was remarkable. I could come home and hang out, and instead of going and putting the kids to bed and going to work, I could watch a movie.
Yeah,
I could hang out with the wife, have a glass of wine. And again, ability to change, ability to give things up. And I was able to do that. And let me tell you, the amount of revenue that came in because of that decision was a windfall. It was one of the best decisions I've ever made for this company.
Yeah. I love that. And I, and again,
I want to make sure I say that. I sorry to interrupt, Kosh. You're like, what decisions you made during COVID did you adapt to your business now? I think making those kind of abrupt decisions beginning of COVID and throughout COVID, just seeing how things, you don't want to do something, but maybe your team says you should do it. And I'm like, okay, we'll do it. I don't think it's going to work. And it works. So then you're like, you get to this point and you're like, right, this is not working what I'm doing.
Yeah.
I have to do something else.
Yeah.
And we're going to make we're going to move in a different direction. If it doesn't work, we can always bring you back in. We've already done that before.
Yeah.
But hopefully it works. And if it works, we're going to go in a different level. And that's where I think getting back to that question.
And well, I love that story because I've experienced this and I get it. I think the tough part with a lot of entrepreneurs and you point out that because I'm Asian and because, hey, we love to own it and be a part of it and not let it go. As I've said, I've took over my family's restaurant, never wanted to be a part of it. But when the pandemic hit, I saw an opportunity. My mom looked like it was time for her, to not work in the restaurant, but there was only one stipulation. You're out. There's one chief here and mm-hmm. I'm not going to work here because we have great team members here to do this job, right? But in that first 6 months, I didn't want to let go of shopping because I felt that everybody that wouldn't go shopping, they get the wrong item or they buy the one that was expensive. Eventually realized I can't do that. So in the first few months, immediately that was gone. Scheduling was horrendous. As good as I am as a scheduler, I'm also watching, what the hours are, right? Ultimately convinced my sister to, on the side, help me do that, right? So handed that off. The technology aspect, reeled in, someone else I know to come handle everything that has to do with managing accounts and calling AT&T, but I think, and it's, whether it's going to watch a movie because of that free time we have, or just being able to sit there and think about the business without work, we say, instead of working in the business, you work on the business.
Right.
But there's always these things you're working, that's inside. And I think the more of those you can pass on to someone else, yeah, guess what? You make less money. Okay. But what you're doing is, man, you're just giving yourself time to think and be creative enough to be ready for the next stage.
You said something very smart there. Instead of working in the business, you get to work on the business. That's an incredible point you made.
Well, I've seen my family do it for years. I've seen them,
we're the hotel business right now.
You're there every day. And
I was in the house today and both, Manisha was there and Prisha, that's my wife and my sister-in-law, and they were both working together in the house. And it's like payroll for the hotels. And they're like, oh, they had something come up. And again, working in the business and not working on the business. So hear them kind of struggling over a couple of things, and I'm just like, man, I'm definitely in a different place, and I'm so happy
Absolutely.
I'm in a different place with Patient Plus. So,
and it takes a mindset. So I love that. I definitely think that adaptability, that wanting to change, wanting to let things go. I would say that this situation has taught us to do that too, because everything's always been the way it was. We're progressing, but I think many industries, processes had to leapfrog. They started taking huge steps forward, into the cashless era, right? Mm-hmm. Into automated work, into work from home. Now, this is a tougher question, and it could be broad, but what do you kind of see as lasting trends from your perspective of the next 5 years,
I think we were on this path, and we were almost at the peak, I thought, at this path of primary care versus urgent care.
Yeah.
I think you had individuals like all these guys, you and me, where we don't have primary care physicians.
Yeah, right? I don't. Yeah.
If you have a medical problem, you come to the urgent care clinic. if you need a prescription refill and your family physician, your internist can't see you today, and they say, well, I can see you in a week, you can pop into an urgent care, and if it's a reasonable, prescription like high blood pressure and your blood pressure is normal, yeah, we'll give you a month's supply. You know, if it's diabetes and your sugars are within normal limits, we'll refill that medicine. Obviously, we're not going to give you insulin, but what we saw here is the utilization of urgent cares just for quicker stuff. I think, I thought we were almost kind of getting to a peak with that, but I think the volume that we've seen and the new patients that we've come in, I think we've just created a whole new generation of patients that trust urgent care to help them with their medical services.
That's a behavior. So that's a behavior that's driving the how we interact and how your business operates.
Yeah, and I think businesses now are coming to urgent care saying, okay, we need to do this kind of testing. We need to do these kind of vaccines. Can you help us out? Yeah. So I think what you'll see in the next 5 years is, urgent cares may take that void where an Uncle Earl's or Startup Grind needs something for their team members, and instead of trying to find some primary care physician or some kind of large organization like that probably puts them on the back burner because they're dealing with the Cokes of the world or the Amazons of the world. We can help those small businesses. Yeah. And again, small businesses helping small businesses, right? Isn't that Startup Grind?
Yeah, right? Absolutely. And that's interesting because we had a COVID scare last summer where I didn't know what to do. I was like, I thought everyone go get tested. And I immediately was looking for a solution or a service where someone would come to us and I could just close the restaurant down for that afternoon. Someone come to us, bring the test. I can see that everyone's good before we get back to it.
We have several of those instances.
Oh yeah. Well, ultimately, I maybe a lack of searching enough. I didn't find something that I could tap into as quickly. Most of my team members went. They got a test. They came back. A few days later, and then there's on the opposite side of that. What's not coming back? What has changed? That there is they say we're back to normal or trying to get back to normal. What's no longer going to be normal?
I mean, I'd almost have to. I'm not too sure what that is in the medical field.
Yeah,
I'd almost say what is that in the service industry?
Yeah. Right. Well, for us, it's transparency. We have a little thing at the bottom of the menu that says, hey, market prices, we change, blah, blah. A couple of things happened. One, as soon as the pandemic came in, we had that cash issue where there wasn't change. We took the 99 cents off of all our menu items. We also included tax into the item.
Nice.
So, and don't get me wrong, it was always the way it started was that everyone would come in and go, $20 even. How many times does that happen? And I'm like, every day.
Right.
Literally the guy before you, But it was really something we had to teach people and because people didn't expect that. So we just keep having we plastered everywhere. Taxes included. There's no 99 cents. There's nothing this is what it costs. And on top of that, yes, we could have the, prices may flux, blah, blah, but we put it on their receipts. Meat surcharge, chicken surcharge. We would just add it because we want them to understand this is what you're paying for, because it's a lot of labor on my team to try to talk and educate every single customer on here's why you're paying X amount. Right. They may not want to hear it. And guess what? By the time they go tell someone else, what they're going to tell someone else is, they're just overcharging me, versus having that clarity. So for me, I think it's transparency. It's ease of ordering. We started our own online ordering, and we've came off almost 60% off of the delivery apps as far as order volume, we get a ton on our website, and we tell people the truth, which is it's cheaper on our website.
Yeah.
and they love that, they love that we talk to them about that because we never did before. We didn't message, we didn't post about this, but now we do. We tell them our thoughts, and guess what? 95% appreciate it. Some don't, but we don't care.
So we this goes back to an earlier point you had also made about some of the things like how you had to, we talk about change a lot today, but what were the things that made you, that you had to change? I was kind of hesitant on telemedicine, right?
Yeah.
So telemedicine, we started. We had to, because we wanted to make sure we gave the patients that option.
Yeah.
We just haven't seen that surge. We saw that initial surge.
Yeah.
But we haven't seen it since. I think people still want to be seen.
I do. I've looked up telemedicine, and first off, it's very overwhelming. So if I look up urgent care near me, there's a list.
Right.
But when I look up telemedicine, it starts with like 5 ads, and it's very overwhelming to decide because the pricing structure doesn't make sense to me. Some tell you it's just this much. Some tell you maybe if you have insurance. Telemedicine to me, well, it's just, again, I guess I'm validating what you're saying, which is unless it comes from somewhere I already trust,
right,
it's not the easiest thing to go and pursue. Because look, I want the doctor to I want him to tap my knee and tell me, hey, it's not broken. I'm like, thank you.
And Contra, I think the other thing besides telemedicine, you were asking, what do you think the trend is? Well, telemedicine, we're just not seeing where everyone's going to do telemedicine for urgent care. Maybe for other practices, maybe. The other thing that we're seeing that our patients love and that we're getting a lot of negative comments now on is we opened up, we have scheduling. So like 24 hours in advance, you could schedule, I want to be seen tomorrow at 4 p.m.
Which there's an app. You have an app?
No, we have an app for that.
Is it Solve?
Yeah, Solve, right.
Love it.
So,
yeah, I like that.
we ran into trouble the past 2 months because people were picking 2:00, but there were like 30 people coming in through the door. So it was like, okay, yeah, we know you're 2, but we've had 30 people come in since 10, and we're still trying to catch up to them. We're going to try to honor you as close as possible, but just got to understand. Yeah. And it's just that that's been the hardest part during this surge. But going forward, I think that's the trend that urgent care, well, I hope I'm not giving a trade secret away, but that's the trend that I think is going to stay with us. Definitely going to stay with Patient Plus. We love it.
Yeah, I like that.
And listen, I'll say that Ellie Thurman was one of our marketing directors before, and she wanted to do that. And she was like, hey, man, these people in Oregon are doing it. I'm like, I don't know about having your appointments. We're trying to get away from that. You just come in and be seen. But eventually, again, ability to adapt, ability to change, make sure. And eventually, we said yes, and we love it. You love it. Look, you're already talking about it. You already know how to get to it.
Yeah. So yeah, it's easy for me. I've done it. I've scheduled it multiple times. I find it, I remember the first time going back, and I'm like, man, I think there's an option to go in as a guest, and I immediately regretted it the second time I went in because they're like, you have to fill everything out. I'm like, dang, I should have made that profile the first time,
Oh, right.
Yeah, because I don't think you're not forced into it. You could just fill out information for this one time, and I regret. But I regretted doing it.
Kasser, it's kind of like when you get something on the phone, right, guys? When you're like, oh, fill this out. I'm like, no, I'm not filling out anything on the phone. I'm not doing that. I don't want you knowing all my stuff, right? So now, after you come back to Patient Plus, that next time you're like, oh, okay, this is why they wanted you to fill it out. Now, I don't have to do all this minutia details again. So,
yeah, exactly. No, hey, heard that. Same thing with we. The way that you order on our site, if you actually make a profile, you could all just pull up your old old order. We've had people come in, and the first thing we do is take their name, and we can actually say, "Are you this customer?" And like, yeah. And they're like, there was one person who was ordering for his wife, and he's like, and I think it's, and I'm like, was it a cheeseburger, no onions, but extra mustard? And he's like, yes. How'd you know that? I'm like, you've ordered before. Like, you gave me your info. You allowed me to know what your order is. And hey, there's some privacy there. I get it. But do you trust me now? I just helped you out, because you would have went home,
you
been
say
upset.
That like about your restaurant, but one of my favorite Philly cheesesteaks in this town is filling me up.
Yeah.
Every time I give them my phone number, they're like, you like your Philly with mushrooms, add jalapenos, don't add this. I'm like, yes, thank you.
Love that. I love that. So I think I'm excited about where things are going. I think privacy is going to be an issue for our future, always will be, but we are definitely.
If you're worried about privacy, get off Facebook, get off of Instagram,
True.
get off of Twitter.
True.
Right? Privacy
Yes.
is not an issue.
Yeah.
I mean, like we just said, we're on our phones like, okay, I'm going to give my information.
Well, let's say it's a concern. It's a concern that's brought up in certain moments. Maybe they're not, maybe they're valid, maybe they're not, but it's a concern. But I think it's just part of, as we trend forward where the requirement of information allows us to do better at our work. It's patient plus educating me on, hey, you don't have to fill this out next time, and you could also just schedule it. It's the service industry allowing people to say, hey, by doing this, if you ever forget your order, all you got to do is just go on and type your name and it's already there. It's already pre-filled out. But I'm excited for that future though, because that allows all of us to do better work, because it's really in the gaps and in where someone doesn't feel attended to, someone feels that, someone is not working in their best interest, or service is just simply bad in some way, shape, or form. Yeah. That's where people's trust really starts breaking down.
Well, I mean, I think that's where medicine is going, what you're saying, in the sense that, okay, hopefully we'll get to a point, and we're getting there with certain platforms with our EMRs, so where you type in someone's name and you can go, oh, they went to this hospital. Oh, they went to this clinic. Oh, this is the medicines they're on. Okay, now I know what medicines are on. Maybe that the patient didn't know it, so I know not to prescribe this because that's going to be a reaction. That is the trend of medicine eventually.
Yeah.
It's just making all these different EMRs talk to each other, or allowing that talk, and then you have the Epics of the world that are, let's say they're the Amazons of the world that don't allow other people, because they're the big boys. So
yeah.
it's allowing all these EMRs to talk to each other so that we don't make mistakes, so that we don't keep ordering CAT scans in labs over and over, so we can reduce medical costs. That's the future of medicine. They're trying to get there. Whether they'll get there, we'll see.
Well, and then this is one of my last couple of questions, and you may have just answered this in some way. What excites you the most for the next year?
Patient plus wise, hey, we're opening up Bruley.
Yes. If you're sick in Bruley, head that way.
Yeah.
What's the opening date?
October 2021.
Okay.
We're looking at some 3 more markets in Baton Rouge. After that, we're looking to expand to, Lafayette and New Orleans, tough markets, because they have plenty of urgent cares there. Expansion, we're looking, excites me. Opening up new lines. That's something that's what's taught me, the pandemic has taught me. Telemedicine, our international COVID units. We opened up occupational medicine during this time. So even though we're going through this pandemic, we opened up a new clinic. We opened up 3 new lines of revenue sources. Just those are things that make me wake up every day and say, okay, what's next? Now, the future of medicine. I think you'll see. Just look at Baton Rouge, right? Look what's happened in Baton Rouge recently with medicine. You have a lot of the big boys swallowing up some of the smaller boys, right? Or girls, let's just say. Let's not be gender specific here. Let's say companies, sorry. A lot of the bigger companies are swallowing up the smaller companies, and they're starting to form these bigger conglomerates. These are some crazy and exciting times in Baton Rouge. Look what MBP did, Mary Bear Perkins. Instead of continuing with a partnership with a bigger company in Baton Rouge, they went with an even bigger company nationwide. So how long can these small companies like myself continue to be independent, continue to make their own decisions? That's a big question in this. And that's what the future of medicine is. How many people are how many large corporations are going to own a town?
Yeah.
So I don't know if I answered what you're saying.
No, that's, well, I think it was excitement, concern, and curiosity.
Right.
All wrapped in one, which is
Patient Plus.
Yeah, which is Patient. Hey, look, I guess the last thing here, one of the big things for Startup Grind, one of the things that we pride ourselves on is the ability for people to connect. And even though no one's able to be here today, and when I sent the email out, I said, no one loves being around a audience more than me. Like I love when people are here. I love connecting with people. But that's what we want to do here at Startup Grind, is be able to connect entrepreneurs. And for those that didn't get an opportunity to connect with you here today, is there a way for them to contact you or reach out to you on social that you'd be willing to share?
Listen, I'm willing to share my email.
Okay.
If you want to reach out to me and ask me questions, interested in medicine, how I even decided to go into medicine, or interested in urgent care, my email is Rubin, RUBIN, at patientplusuc.com. Again, Rubin, RUBIN, at patientplusuc.com. So feel free to reach out. You never know. You never know what that could lead to.
Yeah. Hey, he's opening more and more locations. He might need a bigger team. If you're smart and you're ready to hustle, maybe they can talk to you. Okay. Well, look, that's all I have for today. Thank you so much for joining us, and thanks for giving your time. Thank you.
Thank you, Kasra. And I love Startup Grind, and I'm really appreciative of what you're doing. And shout out to Flashbang. This is the second time I've worked with them. They're doing a great job too. So again, Kasra, thank you again for inviting me for this.
All right.
This talk.
Thanks, Rubin. Appreciate it.